Hey, everybody, and welcome to our lecture for this week, which is on change techniques. So, if you haven't read the chapter yet and you kind of hear the title of this presentation or the topic of this week, you may wonder, well, haven't we been talking about change techniques the entire time? Which is true. We talk about these as kind of a separate group of change techniques because, as you'll see, as we kind of get into the presentation here, these are techniques or areas of work for a client that we are going to use almost universally, meaning regardless of the client's presenting issue, regardless of our theoretical orientation, these are areas that are very commonly worked on and are kind of uh, provide a common thread, an additional common thread through all of counseling. Obviously, the techniques we have learned thus far in the course are common, and this is just an addition to that. But we're talking about very specific areas of change here, and techniques we use to the techniques we have talked about and used thus far in the course can be used in these particular directions. So I think that'll hopefully make a little more sense as we get into the presentation here. So this is what we call the REPLAN model. So it's an acronym. And you can see it, the R stands for relationship, which is kind of the center of the model. And obviously we know is the most influential factor in the therapeutic process. So the relationship is at the center. That's the R in the REPLAN model. And then you can look around the model here and kind of see where the acronym comes out or comes from. But we're going to talk about these each individually. But these are the six areas, including the relationship, that we know almost all counseling is going to address these in some shape or form. So obviously, the therapeutic relationship is going to be central to any kind of counseling process, regardless of setting or modality or theoretical orientation. The relationship has got to be there. We know that. But enhancing efficacy and self-esteem is almost always going to be part of the process. There's going to be some kind of new behavior that is part of the counseling process, even if you're not working from kind of a behavioral theoretical lens. There's going to be some kind of behavior change that takes place. So practicing new behaviors is there. Lowering or raising emotional arousal. So that's just working with the intensity of a client's emotional experience, activating hope and motivation. If a client does not feel hopeful that change can take place or that they can get to a better place, we know that their likelihood of making positive changes is very low. So we always want to be activating hope, instilling hope and motivation with our clients, and then providing new learning experiences. That's really what counseling is about. It's about helping clients experience themselves, their presenting issues, their relationship with us in a new way that is at least in part of the change process. And so those new experiences have to be a part of about any counseling process. So this just helps us think about the work we're doing with our clients from a lot of different angles. Not that you needed kind of additional angles at this point, but it does kind of provide a comprehensive model for us to look at and say, what are the areas of change that are going to take place with our clients, regardless of what they're working on or how we are approaching the work theoretically. So we're going to go through each of these with a little more depth. We're not going to jump into the therapeutic relationship because we have covered that pretty well. We know what that looks like. We know what that is. We know how important it is. We know how to facilitate it. Thinking about Rogers' kind of core conditions of unconditional positive regard, empathy, and congruence. So the therapeutic relationship, we're not going to spend a ton of time revisiting in this presentation. We'll kind of concentrate on these other 5 areas. But first, the REPLAN model is very goal-oriented. As you can see, all 5 of those parts of the model can have goals kind of attached to them. We do know that clients with the same diagnosis might need different treatments just based on who they are, how they respond, what areas of their experience might need a little more work. And so you may have a client that is depressed, who has very low self-esteem or self-worth. And you may have another client who's depressed who they may need some work in that area, but it's not nearly as much as another client. So clients can differ pretty broadly, even with the same diagnoses or with the same presenting issues. It's not just, no client has, at least we shouldn't be approaching them like a plug and play, like we're just going to do this. This thing we did with this other client because they were depressed and it worked, so we'll just plug it and play it here. We'll just do the same thing again. So that's what the same diagnosis need different treatments is about. Within the replan model, the goals are very specific, as we know goals should be, as we talked about previously, and then they are few. And so it's, coming up with just a few kind of clear, specific goals to begin working on. This is a flexible model, meaning it is something we can kind of tailor to, short, brief, short-term experiences. It's something we can tailor to long-term treatment. So it's a very flexible model in that sense. Evaluation and replanning are essential, meaning that, it's not like you set it and forget it at the beginning of the counseling process. You set goals, but you're always very intentionally checking in on those goals to say, where are we in relation to those goals? Are the goals the same? Are we making progress? Do we need to switch the goals? Do we need to switch the focus of the work? And so just revisiting those goals on a regular basis is part of the process. And as I mentioned, it's not in conflict with other theoretical models. You can practice the replan model, you can integrate it or combine it with anything from Gestalt therapy to CBT to REBT. I mean, it can work with about any theoretical orientation. It's not like it's a theoretical orientation in and of itself. And so it really is helpful in that way because it provides kind of a supplemental framework for us to think about the counseling process and the change process. All right. So what it looks like in terms of actual sequence is that first you figure out what the goals and priorities are. And so, a client may have 2 or 3 goals for the counseling process, but we also need to prioritize them and kind of triage them and say, what is it that we need to work on or you want to work on first with, this, excuse me. I often think when I'm working with a client, like, do they have symptoms that we need to work on immediately, like the actual symptom management to improve their quality of life and their quality of functioning in life? Do we need to do that first and then we can get to some of the underlying stuff? But maybe the client's in such a bad spot that getting to some of the underlying stuff while the symptoms remain as intense or as severe as they are is like just really tricky to do, and it's not necessarily in the client's best interest. That's why both setting the goals, but then also prioritizing and doing that triaging of like, what do you need right now, is really important. So you can do that in the replan model. Use the therapeutic factors to generate treatment strategies to achieve goals. So again, we'll talk about the 5 different areas that we can develop goals around. And then replan on a regular basis. So the research on the replan model indicates that about every 6 weeks or so is a good time or a good schedule to kind of stop, check in, see where things are at, and kind of reassess and redefine what the goals are for the treatment process. So, excuse me, now we're going to begin working through the 5 categories, and this is in no particular order. So self-esteem is one that is almost universal in that plays such a critical role in so many diagnoses and presenting symptoms. So the research has shown us that it's definitely present in anxiety and depression, the 2 most common presenting issues for mental health care. It's also present in things like bipolar disorder, substance use disorders. And I think if you think about what self-esteem is, those feelings about self, that, it makes sense that they would be kind of embedded in a lot of our mental health. And so working on self-esteem is almost always, if not a primary goal, a secondary goal, is something we're probably going to see change, even if it's not the focus of treatment. It is made up of 2 kind of subcomponents. One is self-efficacy, and you may be familiar with this term, but self-efficacy is that belief about your ability to do something. So not that you not necessarily like a confidence that you can do it right now and you can do it really well, but a belief that you can do something if you put your mind to it. You can learn to do something. You can get better at something. So it's that sense of I feel like I can do this, even if I don't know how to do it right now. I can learn how to do it. That's what we're talking about with self-efficacy. Then self-worth. I think we all know what that means. That just that idea of like, who am I a worthy person? Do I have value in this world? Um, and that, a lot of things influence that, but those are the two pieces that kind of come together to make up what we think about as self-esteem. So, how do we work with it? Excuse me. Self-esteem is largely a cognitive process. It's how we think about ourselves and how we have intellectually positioned ourselves in the world and defined who we are and the value we have. And so a lot of the work is done from a cognitive framework. So we do know that it can be driven by rational beliefs, poor self-image, and that cognitive ways of working, whether it be CBT or cognitive therapy, RBT, all these ways of working with irrational beliefs and thoughts can be really helpful. And so working in a very targeted way, if you see self-esteem as part of the presenting issue, working on the thought processes around self can be really helpful. So practicing new behaviors, as I mentioned in the slide with the model, the holistic model there, um, new behaviors are almost always going to be part of the counseling process or part of the outcomes of a counseling process, at least. And so we can think about it as, some of the new behaviors that a client is exhibiting might be um, helping them get unstuck. And so maybe their existing behaviors that they have been using and are currently using are part of the reason that their presenting issue is the way it is. And so introducing new behaviors into the counseling process is one strategy for helping clients kind of get unstuck and begin acting in new ways. Um, so some of that can be just depending on how the new behaviors emerge. Some of it can be kind of psychoeducational in nature, meaning we need to talk with the client and let them know why it is that a new behavior is important in the process. And so it doesn't have to be like we're not handing them a book on behavioral change, but it is just being very transparent with the fact that we think a new behavior might be helpful here to practice because dot dot dot. We need to explain a little bit why we're maybe suggesting a new behavior, or if a client has already kind of organically engaged in a new behavior, why we're highlighting it and reinforcing it and telling the client that seems like an important piece of their work moving forward. So, and once we have developed kind of new behaviors, either kind of through the structured conversation in therapy, those have emerged, or a client has just, or like I said, organically kind of done a new behavior and we're just wanting to reinforce it and highlight it. What's really important is practice. And so we know this is, I mean, y'all know this, and this is a techniques class where we're kind of living this, as an example each week where we are practicing new behaviors with the intention of having them become more innate, more conditioned, more of the norm. And we know the only way to do that is practice, like to do it again and again and again. So, how we work with it, as I mentioned, kind of the psychoeducation piece, providing rationale, demonstration of skills. So depending on what it is, obviously some, skills you just can't demonstrate in a counseling session, but, particularly if it's like an interpersonal skill, you may want to model it for them and let them see what it looks like. That could be helpful. And then, practice in session and then homework outside of session is generally how we go about with the practice piece and the reinforcement of the behavior and the conditioning of a new behavior. All right, lowering and raising emotional arousal. So this, as I said a few slides ago, is simply about helping the client change their level of emotional arousal, their level of emotional experience, intensity, however you want to think about it. But if a client's here, emotionally on this imaginary scale in front of me, then we are talking about moving them up or moving them down. But the point is that we're helping them change it. And that in and of itself can be helpful because then they can see that their emotional arousal, their emotional experience can change. It can get more intense. It can get less intense. and we can do things to make it more intense or less intense, which means we do have some level of control over the change process, and that in and of itself can be helpful. So just, I mean, recognizing that for most clients, emotional distress is why they're coming to see us. There's generally something that is upsetting them or that they don't like in their life, and that is why they are coming to see us. Or it's something that someone else doesn't like, that causes a different kind of emotional stress, and now they're being referred to us by whoever, a parent or a teacher or a court system. So reducing distressing emotions is almost always a goal, right? And you can put that in positive language. So increasing non-distressing emotions is almost always a positive goal as well. And then clients always have varying levels of emotional awareness and expression, meaning emotional awareness just being, how in touch with their emotional experience are they? How aware of it are they? Do they have the vocabulary to accurately articulate it? How do they express it? Because clients, you could be really emotionally aware. It doesn't necessarily mean you're going to be incredibly emotionally expressive, and that's fine. It's just recognizing that there's a lot of variance there for our clients in how they are aware of and express their emotions. And so how do we work with it? Lowering emotional arousal is what we tend to think of doing in counseling. It's kind of like someone's angry or anxious in session, and what we're wanting to do is kind of like decrease the intensity of the emotion. So, relaxation techniques can be really helpful both in session, but also providing some psychoeducation on relaxation techniques so a client can use them out of session to de-escalate themselves. Things like meditation and mindfulness are very common practices, very effective practices for decreasing or lowering emotional arousal. The raising of emotional arousal is interesting, and I know we talked about this a little bit when we talked about reflecting emotions, but sometimes clients would benefit from getting more in touch with their emotional experience. Maybe they haven't really tapped into it. Maybe they're aware of it at an intellectual level, but they haven't really let themselves feel their emotions. And for those are situations where we want to think about, would it be helpful to raise the emotional arousal that the client is experiencing? So if we're seeing some kind of incongruence in session about a client saying that they're super anxious, but like they look calm as can be sitting in front of us, that might be an indicator of one is do they just have kind of a unique emotional expression of anxiety, or two, are they really not that in touch with it? Like they know that it's there, but they're not willing to demonstrate it, or they're not really in touch with it because the anxiety, they're not having that kind of full physiological experience that you get when anxiety really kicks in. So there's lots of kind of case examples we can think of when we would want to raise emotional arousal, but we almost all universally want to be thinking about being cautious with that, right? If we're talking about raising distressing emotion on purpose, we need to think through the justification for that, because what we're doing is we're challenging our client to feel worse in the moment, and that's just always something we want to be really thoughtful of. Because remember our ethical codes around do no harm, always do good. And so there has to be kind of a clear therapeutic intent, and there are plenty of reasons to, right? I'm not saying don't do this. I'm just saying be very thoughtful about, I am going to try to increase the client's emotional arousal around this because ... like they've shut themselves off from it, or they aren't letting themselves feel it fully, and feeling it fully would actually be therapeutic for them. And so I generally think about emotional arousal, raising emotional arousal, not as we're doing anything to make the client feel worse. What we're doing is we are inviting the client's actual experience into the room. We're helping them become more congruent, and so we should only do that when we have a clear indicator that they are incongruent, that the level of emotional experience they are having right now is not what they are describing, or is not what they are actually experiencing. They've lessened it themselves naturally, and we want to kind of unrestrict it. Excuse me. So activating hope and motivation. Clients, for the most part, there's definitely exceptions to this, but clients for the most part aren't feeling like super hopeful and great when they come to see us. I mean, there's usually at least some hope that the change that they want to see in their life can take place, unless they're being brought in again by a stakeholder that it's not under their own volition that they're coming to see us. But for the most part, clients who self-refer, who bring themselves into the counseling process, um, have at least some sense of hope, right? Because the idea is that they wouldn't come to see us if they didn't want to change, right? And if they want to change, there's at least some hope that they can. But for the most part, they also may be pretty discouraged. Clients have tried to get themselves to a better place before they end up seeing a counselor or a professional about it. And that can be discouraging for any of us to try to make a change, and especially repeatedly over a period of time, and to not see the change happen. So there may be some discouragement there, which is a reason that instilling hope, activating hope and motivation is really critical. Learned helplessness theory. So I think this is a topic you'll also talk about in crisis counseling, the course. But it's this idea that when someone tries to make a change and they don't see the results, they try to make a change, nothing changes. Try to make a change, nothing changes. When that happens over an extended period of time, excuse me, um, the theory is that people learn to be helpless. They feel like they don't have the power to make the changes they want to make, right? Because they've tried it so many times and nothing good has come from it. And so that's what learned helplessness theory is about, is this idea that over time, if you try to make changes and the changes don't happen, they don't come to reality, that you learn, you get conditioned to believe that you cannot make changes in your life. So, um, so that is one of the things we're working against, is activating hope and motivation is a way to counter that. So, excuse me, assessing the stage of change that a client is in can be really helpful. So pre-contemplation, contemplation, preparation, action, maintenance. Just knowing how motivated they are, where they're at in their motivation and level of hope for the process can be helpful, because then we know where we're working from. If a client is already, maybe they're in the action stage, they've already indicated to us either explicitly or implicitly that they are motivated and they are hopeful about change. That's why they're doing it. They're in the process of changing. So just knowing where they're at can be really helpful. Emphasizing and focusing on the positive and what is changeable, what's within their control, what's not within their control is really important. So those internal factors are really critical. And this can also be a place to challenge with enthusiasm. I like that. Uh, kind of positively frame a challenge to highlight that there is hope for change, and a client is motivated. Otherwise, they wouldn't be here. It can be helpful. All right, so new learning experiences. Again, this is one that makes a lot of sense when we kind of sit down and think about it. But a client is essentially coming to us to learn about themselves, learn about the change process, learn how to brainstorm and find their own solutions, and then implement them and experiment and see if they work, and then go back to the drawing board and assess. And their clients are learning in the counseling process on a continuous basis, and we don't structure it like we do like a classroom experience where there's a syllabus, but it's still a very intentional learning experience. It's just the learning is a little more subtle, and it's all situated within the client's experience. So um, but trying to help a client think through their learning process can be a helpful thing to do. Whether that's kind of a intellectually, kind of a cognitive restructuring, as the slide says, or helping them understand their meaning making process. Either way is helpful. It is really just about highlighting, how do you do this? How do you go through this, the process of changing the way you think, the way you behave, the way you make meaning. Um, and really kind of doing it's almost a kind of the word metacognition is coming to mind, like this idea of like we're thinking about how we think, we're thinking about how we learn. So we're kind of zooming out a bit and trying to understand how it is that we process learning. And so there's lots of ways to do that in counseling. These are just a few examples. Bibliotherapy, so reading. If your client enjoys reading, that can be one that can be really helpful. So you may do an assigned reading in terms of here's a text that you may have found helpful on this particular topic. And then the client comes in, and however you all end up structuring it, but you're revisiting the text in session, and then you're kind of tying it to the client's life. So there's a very intentional processing of what the client has read in relation to what are they taken from the reading, and kind of plugging in or putting a lens on their own life using whatever text that you are reading. Modeling is just showing new behaviors, right? I mean, it's that idea that we can model for our clients, how they may interact. So this could be around interpersonal things. It could be, excuse me, it could be a new behavior that they are trying to learn, and we're modeling it for them just so they can kind of see what it looks like. Metaphors and stories are great tools. That kind of abstract thinking. We know there's a lot of benefit to helping the client see their problem in a new way. I always love it when a client is like naturally metaphorical and they just kind of draw in. They'll like talk about their experience and they'll be like, it's like dot dot dot, and a metaphor follows. Like those are really rich experiences, rich material for us to use to help a client think about their own experience in a new way. Stimuli exposure. This could be, if a client is, I don't know why like fearful comes to mind, but if a client is fearful of something or they're just wanting to try something new, kind of a gradual exposure to that thing can be really helpful instead of just kind of going full bore and just kind of jumping into something. Stimuli exposure can be helpful. Humor can be helpful. Learning to see things in a humorous light. Obviously, you want to be careful with that. You don't want to be invalidating in any way, shape, or form for clients. But humor is a powerful tool. Giving advice, which we'll talk a little bit more about in a second. And then brainstorming. So just coming up with ideas is sometimes helpful. The idea is always, or the point of brainstorming is always idea generation. Like you're trying to come up with a lot of ideas. Not just good ones, come up with the bad ones too. The good ones are usually buried in there somewhere. So brainstorming can also be helpful. All right. So advice. I know at the beginning of the semester we talked about like don't do it, don't give advice. So I'm gonna be contradicting myself here and saying that well there may be some instances where we do want to give advice, but they're very specific. So as a general rule, excuse me, I got a frog in my throat here. We want to avoid giving advice until we really know the client, until we really know them, we really know their presenting issue. We have a good sense of what it is that they are struggling with and how they approach the world, how they experience the world, so that we know how they may process and utilize the advice that we give. The times we want to give advice are limited, so even with clients who handle advice well, we still want the onus and the responsibility for coming up with solutions to be on the client. And so, even when you have a relationship where advice can be utilized, use it sparingly. If you are going to use it, you need to have some knowledge or experience about what you're giving advice on. Don't just like if it just seems like a good idea, but you have no idea if it's a good idea or not. Don't give advice on it. Understand your own experience is different from the client. So this isn't about what worked for you. That's not what we're talking about here. What we're talking about is things that legitimately seem like a good idea or a bad idea, and we know that they are a good idea or a bad idea. Not necessarily, we went through this 3 years ago, and here's what we did or how we got out of it, and therefore we're going to tell the client that's what they should do. Understanding the client's history again, outline the risk and opportunities. So giving advice is not here's your solution. It is here is a possibility. This may work, this may not. And so outlining those risks and opportunities can be really helpful. It's necessary. And viewing advice as a two-way interaction, meaning, I'm sorry, I've been talking for 30 minutes and my throat gets a little dry here. Be able to view advice as a two-way interaction is basically saying that just because you give it doesn't mean it's a directive. The client doesn't need to take your advice if they don't want to. And so making sure that a client knows that and that they feel open to saying, no, I don't want to try that, or that seems like a bad idea, is really important because again, we're trying to be helpful, but also maintain client autonomy at the same time. So when a client is in physical danger, advice can reduce harm and risk. That, safety issues are always a time where like advice is pretty clear cut. Like a client, um, talks about drinking and driving, like saying, client, like that is really dangerous. Like you're really running the risk of harming or killing yourself or someone else. Uh, it's not meant to shame. It's just like, don't do that. Like we know that's a bad idea. If a client is saying that they want to express their anger toward their boss and they're talking about doing it in a way that we know is probably not going to end well, it might be an okay place to say, like, look, I really strongly suggest you don't talk to your boss that way. I don't think they're going to receive that well, and I'm worried about what might happen to you if you talk to them in that way. So those are just, excuse me, a couple examples of when giving advice is like pretty clear cut. One was the safety, the other one's just like you really shouldn't yell at your boss, right? Like that's just not going to end well. And so that's a couple instances where advice might be appropriate. Um, I think this is just as important when not to give it, because remember, we're not giving advice a lot more than we're giving it. So if a client is very dependent on others, this is a situation or a relationship where you want to be really hesitant about giving advice because you're kind of feeding into part of what has caused their problem, which is they can't come up with their own solutions, or they're not relying on their own solutions. They don't believe in their own solutions, and so they're looking externally. And so when we notice that, we want to be really cautious about giving advice. If a client asks for it, I love that one because it's just like if they're asking for it, we probably shouldn't give it. And so if a client asks for advice, that's a good cue of like, I don't think I'm going to tell you. If you've given advice at some point and the client did not respond well, probably don't try it again. It may just be indicative of how advice is going to be housed in this relationship, that it's just not going to be something that works that well. If the client is asking for assurance where the outcome is unpredictable, so they're saying, I could do this or I could do that, what do you think I should do? And like we're sitting here like, I don't know what the outcome is going to be of either of these. Definitely don't give advice in those situations. When you're just trying to influence or manipulate the client, don't do it then. Client has information available and capable of solving the problem with that advice, which is in most cases they do. And when the advice you want to give conflicts with the client's culture or values. So this is more about you and what you think needs to happen as opposed to what is actually good for the client based on who they are and how they view the world and how they identify, then don't give the advice. It's better for the client not to. All right, y'all. That's it. So that was the replan model. Those are the change techniques that are kind of universal in most of counseling. So hopefully that was helpful, and we'll look forward to doing some work around this in class. Thanks, y'all.